Hi everybody and welcome to Facebook Friday. My name is Kate Wakelin and I'm from Neuroendocrine Cancer Australia, where I am the Net Patient Support Nurse, and it's the Friday the 19th of March 2021. So it's lovely to have people join us today. So every Friday we broadcast to our neuroendocrine cancer community to really focus on usually pick a topic of the week to focus on, and as you can see we've got a guest expert with us today, and I'm really excited to have Kathy along to share some of her really quite unique and important story. But before I go any further, I do want to acknowledge the traditional owners of the land that I am broadcasting to you from, which is the land of the Wurundjeri people of the Kulin Nation, and just would like to pay my respects to elders past, present and emerging, and knowing that people are joining us from all 4, 6, 8 corners of Australia, just extending that acknowledgement to wherever you're joining me from today. One of the things I love about living on Wurundjeri land is running by the Yarra River, which in the Woiwurrung language is called the Birrarung. So yesterday I went on a blissful run along the river, and things like that I think help me feel connected to place and to feel grateful for where I am. So and also I think it's a useful reminder for us all to be, I know last year we were starting all of the lockdowns for COVID, and we were really focusing on, well, what can we do to feel connected to nature and sort of really make sure we get outside even when things are feeling locked down. So maybe it's a good reminder to everybody to, if you've got a chance, to spend some time outside with your feet in the soil, or to be breathing in the fresh air, or listening to the birds screeching or whatever is nearby you, then to take that opportunity. Just before I introduce Kathy a little bit further, I did want to just give a brief update about the situation with COVID vaccine. So there's been it's been an interesting week. I think the first thing was that there was we were aware of some halting to the rollout of vaccines in some of the other countries where they were rolling that out. It was particularly in relation to the AstraZeneca vaccine, and some concerns around very small incidents of but particular types of blood clotting issues. And there's been some more research around that this morning, and essentially the Australian researchers and the people who make the rules in Australia about what vaccines will be available have really evaluated that very closely, and have established, and actually but it's been established internationally to still be safe, and certainly much safer than having COVID. So it'll be interesting to see as that rolls out if there's any tweaks to the way they advise people about the AstraZeneca vaccine, but the guidance still very much at this point is that that's a safe vaccine and important to go ahead with the rollout in Australia. The other thing I would just say is that phase 1B rollout started this week. So most people with cancer are in that 1B category in Australia. And there has been, look, I guess it's going to happen that there are little hiccups and things along the way. The government said, go to the website, and you can go into your eligibility checker, and I'll make sure I put the link up for this in the notes, and then it gives you a list of about 20 practices within the local kind of postcode area of you. Most of the centres are GP clinics. Most of them are booking by phone. So what's happened obviously is the government have released this information, and lots of people have got quite motivated to move on this, and unfortunately that's meant that lots of the GP practices, their receptionists have said, hang on a minute, we can't vaccinate thousands of people all at once, and in the meantime they're having to try and still respond to their normal business, people who are turning up with coughs and skin issues and all of the things that general practice normally deals with. So it has been a little bit chaotic. So I guess if you have been thinking about whether to make that phone call to a GP clinic to make a time for a vaccine, I guess the broad advice is just let's everyone take a patient's pill, and we might need to give the systems just a little bit of time to settle down. So I know some people, I've spoken to one person who was able to do an online booking, and they've got an appointment for Monday to have their AstraZeneca vaccine. So that'll be really interesting to hear their experience. And certainly lots of the health professionals in phase 1A have been having their vaccines already. So 1B is starting, and I'll look forward to hearing people's experience along the way. Certainly there's been some diverse experiences reported in the media, but if there's information that we can help convey to everybody to make that easier for you, then we'll certainly be onto that. So I am just looking to see that people can see us, and it looks like people can, so that's excellent. And look, we've got Kathy along joining us today, and there are some questions that I've talked with Kathy about ahead of time, and a couple of people have actually emailed me with questions for Kathy. But if there's things that you want to put to Kathy that you'd like to get her thoughts on as we talk, then please do put them in the comments section. And just also the disclaimer that I always forget to give at the start of these talks is that obviously this is general information only, and for your own situation, absolutely talk to your doctor, talk to your healthcare team. NETs is a huge category of different sorts of cancers. This won't be relevant to every person, so don't panic if you're listening along and no one's talked to you about hearts. Maybe this is not relevant to your particular type of NET. So always talk to your doctor. You're welcome to get in touch with me afterwards if you want to know more. So Kathy, welcome to Facebook Friday. And can I just say, it's so brave of you to be happy to share your story and put your mug on the screen, because you're a patient with NETs, and you're beaming into us from the very warm Queensland. I'm just wondering if we could start, please, if you could just give us like a very quick snapshot of what your, I don't know, you want to use the word journey, but what your experience with NETs has been, if that's okay.
Thanks, Kate, and thanks for asking me to come along. I'm quite happy to share this experience because I found it really difficult myself to get information, so any bit that you can get is helpful, I think. Okay, NETs, I was diagnosed in 2016. It took, like many people, quite a while to get a diagnosis. I started having dramatic symptoms, I guess, in December 15. We went through a whole lot of scans and endoscopies and various bits and pieces. I had carcinoid syndrome quite dramatically, but it wasn't obviously diagnosed as that initially. I came back after the first few months with an IBS diagnosis, which didn't help me very much. And I tried a number of diets and FODMAPs and all sorts of things along those lines to try and deal with IBS, but I found that didn't actually make much difference at all to my experience. So I kept on saying to the doctors, no, I don't think that's helping me, and I'm not sure that we've got to the answer. And they started looking at me more and more doubtfully as time went on. And I did get the feeling I was being treated as a bit of a hypochondriac for quite a while there. Anyway, a little way down the track, I started to have circulation issues, and I started to swell. I also had a lot of pain and was having difficulty in walking. I had a lot of abdominal pain and couldn't really walk more than 150 metres or so. And then I started to swell up at the top of my legs and all around my pelvis. That eventually got me referred to a vascular doctor, and he sent me for a full scan with contrast, which then finally showed all of the mets that I had all over the place. And what was causing the swelling was that I had a lymph node that was sitting on the vena cava that was blocking the circulation and therefore causing this. Anyway, once I got that scan, I was in to see an oncologist within 24 hours. I think they had me in there because it was quite extensive. And they had me for a biopsy on one of the liver lesions within 3 days. So it was all very quick. And then they found out that it was neuroendocrine and pretty promptly referred me over from the private oncologist, who was a neuroendocrine specialist, straight over to the Royal Brisbane to see the team over there. And I was lucky in that I was put into the Lutate, the PRRT program, within 2 months, I think, of being diagnosed. So that was really quick. And I then had 4 rounds of Lutate with chemo. And I've been stable ever since, which has been fantastic. So the Lutate just stopped everything in its tracks. I've also been on Sandostatin injections. I do a 3-weekly Sandostatin injection. My carcinoid syndrome's pretty well under control. I have top-up shots every now and then, but not very often. And all of the subsequent things that develop, you know, when you've got neuroendocrine cancer and are on the SSAs, I've got blood sugar issues. I have low blood sugars rather than high. I've got hypertension now that I've never had previously, all of that sort of thing. So, but it's been now since 2017 when we finished the Lutate that I've been stable. So all my scans since then have come back stable, is the word that they use, despite the fact that I've got Mets all over and we haven't removed any, and they're all through my skeleton and my liver and in my pelvis and so forth. I live a pretty good life despite all that.
It's often really when I see younger doctors looking at scans from people with NETs, they often look a bit horrified because the PET scans can look like there's been a Dalmatian visit, you know, and I guess that's the thing with NETs, is because they're relatively slow growing, the body actually adapts really incredibly to the presence of lots of tumours like that, and in a way that's really different to if it was other cancers. But like you, Kathy, lots of people live with relatively stable disease and live really well despite the scan looking so very alarming. So I think you're in good company, and the story that you've told about your diagnosis is really common, where people have symptoms and they are diagnosed with something, you know, irritable bowel or FODMAPs or some kind of food intolerance, and maybe they're sort of starting to have a conversation around going and seeing someone to talk to about the way they're feeling about life, because maybe there's a bit of hypochondria or, you know, psychological stuff going on. So like you, I think this is a common narrative that we hear from people. And sometimes when they find out what's causing all of these problems, even though it's a cancer, it can actually be quite a relief to have a name and to know that there's something actually real causing all of these issues for them.
It certainly was. It was a relief to finally get a diagnosis and to know that it wasn't in my head. I wasn't imagining all of this, and that feeling of constant anxiety, there was actually a reason for that feeling of constant anxiety. It was good to know that there was a base cause for that. It wasn't just in my head.
Yeah. So I know that you had a lymph node very close to your heart, and that was actually part of your diagnosis. But you've recently, and actually I didn't talk about this during the introduction, but the reason we've got Kathy joining us today is that she's had valve replacement surgery in her heart. So Kathy, I'm wondering if you could tell us, how did you discover there was a problem with the valves in your heart, and how long ago did that start?
Okay, so I believe we should have known about it really early in the piece. I did have an echo right at the start when I was just diagnosed, but we never discussed it. What that echo actually showed, it was all in the midst of.
I'm just gonna explain the shorthand, because we get used to saying the word.
Sorry, yeah, echocardiogram.
So an echocardiogram, yeah.
Sorry about that.
That's
So we did do an echocardiogram, but we didn't talk about it. We were too busy working, finding where all the cancer was and seeing how aggressive it was and discussing what we were going to do about that, to really be talking about what that echocardiogram also showed. So we didn't really talk about it. It just blended in with all the other tests that were happening. Then I knew that I should have been watching my heart, but we weren't doing the annual echocardiograms that we should have. Anybody that has, I believe, anybody that's got carcinoid syndrome, that's presenting with carcinoid syndrome, because that's an indicator for the potential for the heart damage, should be having an echo every year, but I wasn't doing that at the time. Then in the beginning of 2019, I started suffering from a thing called SVT, which is, you can give the technical term for it, but it's easier just to call it racing heart. What happens is, what was happening to me was that my heart would switch into a much faster pace than was normal and then just sit there for a very long period of time. The first time it happened, it went up to about 170 beats a minute, I think, and then it sat there for an hour, and I went to the doctors with it, and the doctor sent me to the hospital, to emergency with it, and emergency ultimately gave me an injection, which is quite dramatic, which stops your heart for a second to reset the pace. So that was all very dramatic, but we didn't know what was causing it. So we looked at whether that was being caused by carcinoid crisis. We looked at whether that was being caused by the blood sugar issues that I was having, because I get hypoglycemia episodes. It took a while between that starting to happen and it progressively became more regular, and actually getting to see a cardiologist about it. So there was quite a long period there between those episodes, that SVT starting, and consulting with a cardiologist quite a few months before I got there. Now, we got to the cardiologist and they immediately told me that I had heart valve damage, and they were looking at some scans that we'd done at the beginning of 2019 that I'd never been given results for, unfortunately. And they showed it to me on the screen and said, "That's your valve there." And I said, "But it's not moving." And they said, "No, that's the problem. It's not moving." I said, "Well,
I think there's a problem when you as the patient looks at something that's and you can tell there's a problem.
Yeah. Well, it is quite confronting, and it wasn't a minor calcification. It wasn't damaged slightly. It just simply was wide open and immobile. And I believe I'd been living with it in that condition or close to that condition for quite some time, because I'd had this pulse that I could see in my neck that was quite visible, which I never really understood what the reason was, and we'd never investigated what the reason for that was. Despite a couple of doctors commenting on it, we'd never gone and found out why that was. I'm not sure why it took so long to get to a cardiologist. Anyway, they ended up referring me to two cardiologists. So one to deal with the SVT, the heart racing episodes, which they treat as an electrical issue, and one to deal with the heart valve. And the heart valve cardiologist didn't want to act on it. He said that the surgery was very high risk, and he didn't think it was impacting on me sufficiently to justify doing the operation. And he wanted to just leave it and watch it until something more dramatic happened. That was in August, September 2019. I wasn't really comfortable with that advice. So I went back to my oncologist and told him what the cardiologist had said. And he said, "Well, that assumes it's going to fail in a minor way." I said, yes, it does, doesn't it? And I'm not sure that I'm happy with waiting for a potentially minor failure of some sort, given that, you know, I'm not in the heart world, I'm not particularly old for you know, heart procedures, and my carcinoid syndrome is pretty well under control. I don't know how I feel about just waiting, because it's not as though it's going to improve at all. It's not going to get better, and I'm not going to get any stronger than I am now to be able to deal with any kind of surgery. So I don't know what we're waiting for. Anyway, and I'd subsequently gone off and read a whole lot of stuff on the internet, and some of which was quite frightening, and some of which was sort of said that the gold standard treatment, if you're a stable neuroendocrine patient, the gold standard treatment is to replace the valve. So I asked my oncologist to refer me to the cardiologist that he referred his NETS patients to, which took some time. This was all through the public system. That's where my oncologist is now, or has been since 2016. And then they ultimately referred me over to the Prince Charles Hospital, which is the heart hospital here in Brisbane, and to the surgeons over there. And they just said it was pretty much a no-brainer for them. You know, well, what are we waiting for? Let's just fix your heart valve and give you some quality of life back, because in the meantime, the SVT was getting more and more frequent, and my fatigue level was out of control. It was just quite ridiculous. And it's a bit hard to know when you've got heart issues how much of the fatigue relates to the heart issues and how much of the fatigue relates to the fact you've got stage 4 cancer. You don't really know what it's attributed to. All I knew was that I was exhausted all the time. So anyway, we went to the Prince Charles Hospital and they said, well, let's fix it. So, and of course that was at the beginning of COVID. So then it all went on hold for quite a few months, and eventually we got in to fix it in September last year.
So just as a bit of background, we haven't talked very much about why people with neuroendocrine cancers can have issues with their heart, and that's something that we're not going to go into today, but there is a link in the notes to another video that talks about NETs and connective tissue. So I just would draw people's attention to that. If this is a new concept to you and you're watching and thinking, what, that I never knew that there was anything that we needed to worry about with hearts, then it's worth having a look at that video. The other thing I would just say is, actually I asked one of the cardiologists who's spoken with one of our support groups about some stats about it, because again, we hear about this being an issue, but I wasn't sure about how frequent it was. And he said, so this is Dr. Daniel Chekic, who's from South Australia, and he said that about 30 to 40% of people with neuroendocrine cancers get carcinoid syndrome, and of those people, between 20 and 50% get this issue with heart valves. So I think that's the really important thing to say, is that it's related directly to carcinoid syndrome. So mostly it's people who have gastrointestinal NETs that get carcinoid syndrome, although some people with lung NETs also get this issue, which is the flushing. I'm feeling funny because I'm having a massive hot flush as I talk about this. This is not, but certainly flushing and the diarrhea with carcinoid syndrome is the thing that it's the serotonin that essentially damages the heart valves, which causes the need to have heart valve replacement surgery. And I think that your experience is probably really common, Kathy, in that mostly people, if they've got stage 4 cancer and they've got some issues with their heart, the heart doctors will look at their scan, look at that Dalmatian polka dot scan and go, oh my goodness, this patient's got far more important things, really urgent things to be addressing here. They've got all of this cancer. We don't need to worry about the heart. We need to worry about the cancer. But because neuroendocrine cancer is quite different, as you've demonstrated so clearly, you can be stable with the neuroendocrine cancer, or stable in inverted commas, for years. But the thing that's really holding you back and causing you to really suffer in terms of your quality of life is seems to be directly related to the heart issues. And so, but having said that, it's an enormous operation, and I'm looking forward to asking you about this and for you to tell us your experiences of what it was like to go through that operation. So for doctors, they don't want to recommend something that it could be potentially kind of, you know, there's life-threatening side effects and consequences that can happen from the surgery. So they want to make sure people are, you know, that this is actually going to have an overall benefit for people, broadly speaking, and that's a difficult decision to make. So there'll be lots of, I think when it's a tricky decision like that, there will be lots of different opinions. But I think the thing that you've done so well, and actually all the way along I'm hearing this from your story, Kathy, is that when something hasn't really sat well with you, that you've been confident to ask more questions, get a referral to someone different who you do feel like you kind of connect with and who can give you what feels like a reasonable explanation and plan of management, so that you feel like you're managing your disease and your wellness in the best way possible. So yeah, I'm just wondering.
Can I just say,
yeah,
I just have to say, I didn't go for the second opinion looking for someone just to say, yes, they would operate on me. I went for the second opinion, but to hear someone else's opinion, to say, is this the right approach to be having? Should we just be waiting until, you know, things, because the right side of the heart was quite enlarged, and is that the right thing? Should we be waiting for that to worsen? Or should we be doing something about it now? It wasn't just find someone who would say yes to the surgery at all.
I think that's a really important thing to highlight, and I'm glad you said that, Kathy. So once you had a plan for going ahead with the surgery, I know that you did quite a lot to prepare for that. I wonder what that was like for you, both in physically preparing, but also what that was like for you emotionally, gearing up for this really big operation.
Oh, it was terrifying. I was really frightened about going in for this surgery, partly because of the first doctor's advice, partly because of how much I'd read online too, which, you know, I like being informed, but then on the other hand, I don't like being informed. So yeah, it was nerve-wracking going into it for me and for my partner. He came along before I'd been scheduled for the surgery, he came along to one of the echocardiograms and saw my heart up on the screen. And I mean, he was fine during the echocardiogram, but afterwards when we came home, when he told me what his reaction had been to seeing that valve just doing nothing, it had a big impact on him as well, which more than I expected that it would. I mean, I knew he'd be concerned for me, but I wasn't expecting quite that big an impact. So there was that as well. I am a bit of an exercise junkie, so I did continue with that. Despite all of this stuff going on with my heart, I was still exercising 3 or 4 times a week, doing what I could with the fatigue levels and the limitations that I had, just to keep moving, because that's really important for me emotionally to do that. And I also thought it would make the recovery from the surgery easier if I went into it as healthy, you know, as fit and healthy as I could. So I maintained that to the level that I could. And along with that, I do a yoga practice 2 or 3 times a week, so that as well, to keep some mobility up. So I did maintain that, and I went, that was right up to, you know, the day of going into hospital. I continued with that. I'd had to do that. There's a whole lot of prep that the hospital insists that you do. You have to go and get signed off by the dentist to say that you've got, because teeth can have enormous issues on your heart. So you had to go to the dentist and get all of that. And this was all during COVID, so there were limitations left, right and centre. And we had to sort out my anemia. I was slightly anemic, so we had to deal with that as well and get my iron levels up, so that they didn't want to operate until we could get them up to a certain point. they stress to you before, they give you in graphic detail what's going to happen after the surgery, what you're going to wake up to, which is good because otherwise it would be quite frightening. But they do stress to you that you will need help when you come home, and that is, I wouldn't underestimate that at all, because you're very, very limited in how much you can do, and you can't really lift anything. You can't even put your own compression socks on. So you do need somebody in the house. So you have to organise to make sure that at least for the first week or two, and then during each day after that, that you've got somebody at home to help you, because you do need it. You're a little bit helpless for a while. I don't know what else I did to prepare, really, except prepare my kids, tell them that this was all happening. It's a bit of a shock to them. They had known since March, they had March to September to get used to the idea. They were obviously quite, I've got 2 adult and 1 teenager, and they were obviously quite nervous about the whole thing.
Do you know what they did when you were in the operating theatre? Did they talk to you about what that waiting was like?
I went in during COVID and there were no visits. So I had no visitors for the time I was in hospital. So we only had, text and phone conversations. So we didn't really get into the detail of what everybody was doing every day, unfortunately.
I can't imagine. It was stressful enough to go through this without COVID, but not being able to have people who you know and trust visit you. That must have been just so hard, Kathy.
It was a very quiet ward by comparison to normal, I'd imagine.
What was that like for you in that, like, what do you remember very much about that initial couple of days post-op and then the rest of your stay in hospital?
I'd like to say no to that, but I do. I'd rather I didn't. It's very dramatic surgery and it's extremely painful. And I had difficulties with the pain medication in that one they usually use made me really violently ill, so we couldn't use that. We had to take it down a level. And then the one a level down still made me ill, so we had to halve the dose. So I was not anywhere near comfortable. And it is a bit like waking up to an elephant sitting on your chest, and that feeling stays for quite a while. It's not an easy recovery. I would not recommend the experience to anybody.
And I think it's important to be honest about these things, isn't it, Kathy? Because if you don't know that this is what is, and also just to say that everyone's different, and usually we do get, it sounds like your experience with pain was more difficult than usual. So I would say that most of the time we do have much more success getting on top of it. But having said that, you can't pretend that having your chest cut open isn't going to be really quite painful. And painful for how long for you?
Oh, well, it's probably, they recommend that you sleep on your back for 6 weeks, which is very noisy if you snore. And I sort of assumed from that at 6 weeks I'd be able to turn over and sleep on my side, but I still couldn't comfortably do that for 6 weeks. It was probably another 2 to 3 weeks, I think, before I could lie on my side. It's the full recovery. I think it's a good 3 months before you feel good again.
I was going to ask you at what point, knowing that you were so weak before your surgery and so tired, at what point did you feel, obviously you would have felt worse for some time before you started to, get improvement, and at what point after your surgery did you feel better than you did before the surgery, if you like?
I probably started to feel better at about 8 or 9 weeks that they give you all the physio exercises to do. And that involves walking every day, and it's progressively increase the distances that you're walking and the inclines that you're walking. And at about probably 8 weeks, I suppose, I would be walking up a hill and stop and think, oh, I couldn't have done this so easily, actually. Even though it's not easy yet, I couldn't have done this much before the operation.
Right.
So despite all the exercise and whatnot that I was doing, I still had that, dreadful fatigue that made everything so hard. So, yeah, at about probably 8 weeks, I started to notice differences in what I could and couldn't do. It is a long time to get your strength back up, and it's a long time to get your lung capacity back. That takes quite a length of time. But when you do, it's in my case, it was a huge improvement. Once I got there, enormous improvement. I mean, before the operation, I would lie down at lunchtime and open my eyes 3 or 4 hours later. I don't do that anymore. I've got my days back, which is brilliant, and I don't have, there's a particular type of fatigue where you walk up a single flight of stairs and at the top of the flight you just feel this flush of fatigue through your body, which is, I don't know what that is, whether that's oxygen lack or something. I don't get that anymore either. So, it's made, and the SVT episodes that they said were unrelated, that were an electrical thing and not related to the valve, I haven't had one since the operation.
Yeah,
so
that's really interesting.
Obviously that was somehow related, probably to do with the distension of the heart. I don't really know, but I'm just glad that stopped, because they were really tedious.
So what can you do now that you couldn't do before, apart from climb a flight of stairs?
Oh, well, I've got my days back. I don't have to. It was to the point, I think, when my family were just watching me sleep away the days, and we'd plan things and then not get to do them because I'd be too tired. Or I just spent day after day sleeping, and I'm not doing that now. You said something before that my colour looked good, and that's because we've been away every other weekend.
Wow.
Because of camping every couple of weeks, just because I've got the energy to do that, which is, fantastic.
So not only are you doing stuff all day, but you're able to go camping in the weekend, which actually, even just when you're not sick, it takes a fair amount of energy. So yeah.
Wow. So much better, and my family's enjoying it too. We get to do more stuff.
Was there any point where you were thinking, oh my goodness, I've made a terrible mistake, what have I done, is this going to be worth it?
No, I don't think I ever thought that, because I'd read so much and I knew where I was going. Like, I knew where the inevitable long-term outcome, what the inevitable long-term outcome was going to be, or potentially short-term outcome was going to be. And I didn't want, I want longevity. I want as many years as I can get. So, yeah, I don't think there was any point. There were points where I wept and said, I wish this pain would just stop. I'm tired of it. But, no, I never thought I shouldn't have done it.
So looking back now, like, you're a good, more than 6 months post, aren't you now?
I am.
What did you not know that you would have liked to have known about this whole procedure and how you'd be?
The 6-week thing, when they told me 6 weeks on my back, I set in my mind, well, 6 weeks and I'll be up and at 'em and doing all these things.
Right.
And, I'll at least be able to sleep comfortably. And I wish I'd been a bit more realistic, or someone had told me to be a bit more realistic about that expectation. I did do a physio program. The hospital offered a 6-week rehab program, which was brilliant. I highly recommend, if anybody's having this surgery, that if they have an opportunity to do any rehab program, if they can access it, because it just makes such a big difference to have someone guiding you through that physical recovery and getting you back to being stronger and fitter again. That was a huge help. I had a man-made valve put in because of my age. They didn't want to put a tissue valve in because they say they only get a certain number of years out of them. I'm not that old.
Is it rude? Can I ask you? What
I'm
decade?
55.
Yeah.
I'm 55, yeah. So not that, you'd hope I'd get a few more years.
You want that valve to last a really good long amount of time.
That's right. I want lots and lots. I want decades out of that thing. So I'm on warfarin. So that's made the sandostatin, the octreotide injections, really interesting.
So just to go back a step, let's explain what warfarin is. And I think this is a really important thing to talk about. So warfarin is a drug that it's an anticoagulant. So it stops you developing blood clots, which are more likely to happen if you've got anything artificial in your heart, because there's bits of hardware in the way and you can get little collections of platelets around the edges of the device, the artificial device. So anyone who's had a heart stent or a heart valve replacement, anything like that, we put them on warfarin. But tell us what's happened with the injections as a result.
Well, the first couple of injections, I get them every 3 weeks, and the first 1 or 2 were all right until we got the warfarin levels balanced out. Once we got the warfarin levels balanced out, which meant my blood was nice and thin, I started getting these, and we all know about, we talk so much about the lumps that you get from these shots. So I know all about the lumps that we get from these shots, but these were off the chart. These were enormous, big swelling things. And it was after 2 injections of having the same thing. And I have home injections with a wonderful nurse. And we were discussing it, obviously, each time. And we sort of came to the conclusion that it was the warfarin that was causing the issue, that it was just bleeding on the inside. And I did also speak to the GP about it. So we've started, I now ice for half an hour beforehand, and then I put pressure on immediately after for a good 5 minutes or so, and then I ice for another half an hour afterwards. And I think that's working so far since we started doing that. But without all of that, I was getting, well, I had one that lasted 9 weeks, I think. So, yeah, big lumps and big bruises. And, yeah.
So uncomfortable, isn't it, when you've got a lumpy sore?
It is when you know they're coming back in 3 weeks' time to do it all again.
Yeah. Yeah. It's not resolving.
And when you're, avoiding the big one, and you end up just injecting the same side over and over, then that side becomes an issue. It just goes on.
I know that a lot of people get lumps regardless of whether they're on anticoagulants, and I know anecdotally that a lot of people do use ice, and it just makes me, I guess it reminds me about that, and maybe that's worthwhile for people watching as well, is a lot of people do use ice actually just to numb the area, because that can be quite effective, and then ice afterwards to reduce sort of pain and inflammation from the injection. But I'd be interested to run a little bit of a clinical trial on ice and lumps and see if that actually made a difference for people more broadly. I think for you, as Kathy, with the anticoagulants on board, that was clearly, that's clearly been helpful, which is great. But it makes me wonder about other people who get lumps and whether you find ice helps. And is there anything about, I know we talked about the way you felt leading up to the surgery and how terrified you felt. What was it like after you had the operation in terms of your emotions?
The first few days in hospital, it's quite overwhelming because it's very dramatic. Once I got home, though, it's hard to know if my experience is the standard experience, because everybody experiences pain and discomfort to whatever their own, response to that is. So I found it hard going, but knowing what I was headed, what I was working towards, that I was working towards longevity, really, I wasn't depressed or anything. I was just a little bit over the discomfort and the pain now and then. But I had family around me and they were running around and doing everything at my whim. So
how long was it till you could laugh without pain? That's an important question.
Oh, yeah, that's laughing's not too bad. You have to cough every day to help to just get your lung capacity back, and that's, you don't look forward. You have to cough a lot every day. You don't look forward to doing that. That's really quite uncomfortable. And you're doing breathing exercises every hour for weeks. It feels like forever, but it goes on for weeks. So yeah, it's I mean, the first couple of days I couldn't turn on a light switch, if that's any indication. I couldn't do that.
Yep.
Which is
and again, it's important to be realistic about what your expectations are, I guess. And now, Kathy, what can you do? Like, I mean, I know we talked about flights of stairs and getting through the day and going camping, but you mentioned that you're a bit of an exercise junkie. What's a workout for you? What
I was running last weekend. I was running, which is, I haven't run in years. I haven't run since diagnosis. And I was at the gym last weekend and running, thinking, oh man, look at me now.
Wow.
Who is this woman? She's back, which was, yeah, it was brilliant. Good feeling. And I still exercise 3 or 4 times a week, and I still do my yoga and all that sort of stuff, but it's at a different level to what I was doing before. So yeah, it's really good to be. So don't get me wrong, I still have nets and I still have cancer fatigue and all of that stuff, all of those symptoms, like that's all still there, all of those symptoms, they don't go away. Last night I had a bad night and thought, oh, that's perfect, right before I'm going on Facebook Friday. But
we haven't had to run away while we've been talking, so I'll count that as a positive.
Yeah, so I still have all of that stuff going on, but my energy levels are so much better, and I don't have this SVT interfering with my life, you know, the way I'd wake up to my heart going 140 beats a minute for no apparent reason every week, and just went on and on.
Oh, no,
so yeah,
so tired.
all of that stuff is gone from my life for the time being. And we did actually go in looking at doing 2 valves. They had said there was potential that they'd end up doing 2, but we did only do 1 in the end. And the doctor that treated me, Dr. Tessa at the Prince Charles, who's inordinately experienced, has done a large number of neuroendocrine patients, so he knows what he's doing. Yeah, so we did only end up doing the 1.
I think the other technique that and I'm going to tell you this, there's a comment here saying, wonderful guest, thanks, so informative. So Kathy, I know people are watching and really appreciating sharing your story, and because not very many people, you know, NETs is uncommon, and then having carcinoid heart disease is uncommon, and a lot of the time we manage to keep that stable enough that people don't need the surgery. So actually having the surgery is uncommon as well. And then having someone who's had the surgery, who's happy to come on and do a video with us. So we feel very privileged to have you and have you describe your experiences, because I just think it makes so much difference if you know what to expect. You know, okay, I probably won't be able to turn on the light for a couple of days, but maybe in 3 or 4, you know, 2 or 3 months time, I might feel better than I do now. So just to have the expectations there, but to hear that you're now running is extraordinary.
I know. Yeah, not much, just a little.
yeah, but that's fantastic. It's so fantastic. And we so appreciate you sharing your story. I feel like I had another question for you, and I've just talked myself into a different corner, and now I can't remember where I was with the question. So it might come back to me. This is, I guess, a last chance for people, a last chance if you want to put questions in the comments box, this is your time. Someone else has said, never gave my thought a second thought, gave my heart a second thought. So that's an interesting comment. And again, just to emphasize that not every person with NETs is at risk of carcinoid heart disease. But if you get carcinoid syndrome, you really should be having, you know, an echocardiogram at least every year. Sometimes for some people, they have echoes every year and nothing ever changes, and they might stretch it out occasionally. But actually, if someone's got existing, you know, we know that they've got carcinoid heart disease, you're more likely to be recommended to have your echocardiogram every 6 months rather than every year. So I guess that's the advantage of talking to a doctor who knows about NETs, because it's not that common, but it's a really important thing that can have such a big impact on your quality of life. I've just remembered the thing I was going to say, which is more recently they're always working on new techniques, and I know they've been working on a new technique with this valve replacement surgery to do it using what they call minimally invasive surgery, so going up through a vein in the groin, and sort of threading a collapsed artificial valve up through your circulation system to your heart, and putting it in place, and it kind of pops open in place. I haven't spoken to anyone with NETs who's had that procedure yet. I did have a lady who was going to have that last year, and that ended up not going ahead, mostly because of COVID, unfortunately. But we will look forward to, you know, if once I've got people telling me about those stories, I'm really hopeful that I'll be able to get someone else on who's had that other procedure to share what their experience has been like too. Yeah, so and I'm just seeing more comments from people saying, you know, fantastic to have your story. So we really appreciate it. So thank you, Kathy.
I hope it's been helpful. And I would stress that that's my experience. I mean, that's not by any means everybody's experience of having heart valve replacement with neuroendocrine cancer. I'm sure there are some very different experiences to that.
I think you're right, but it's so useful to hear yours. So that's really generous of you, Kathy, and thank you. I think this has been a really good news story, and this week in our Facebook private discussion group, it's been wonderful actually that lots of people have come in and said, you know, my scan was stable. You know, I've actually had good results from my blood tests are normal. You know, and it's been a really good reminder to us all, I think, about the importance. We share a lot of stuff that's hard in our support groups, and particularly in our online community on Facebook. And sometimes it's easy when you're busy and you're well to sort of forget to post about the things that are going well in your lives. But gosh, that's powerful and wonderful to hear when you're receiving stable disease. Like, that's actually, you know, music to our ears when you've got NETs, because stable can be stable for such a long time, and it's good news. So thank you to everybody who's hopped in this week and shared their thing that's going okay or going well in their lives. It's so wonderful to have that in the mix. You know, there's a lot of hard stuff, and it's great that there's also a lot of good stuff, and so we want to remember to share those experiences as well. One of the things, you know, a couple of weeks ago especially, we had a hard couple of weeks with some group members dying, and sadly this does come up in our groups from time to time. And one of the things that I wanted to just mention, I was talking with some colleagues from the Cancer Council, and I was prompted to remember that there's actually a bereavement support group that they run over the phone. It's a telephone support group, and it goes for 6 weeks. They run it regularly throughout the year with a new group of people. It's called Life After Loss, and I'll make sure I promote this in our carers online support group as well. And sadly, this has become a little bit more relevant recently. So I did want to mention that there will be a new group starting probably towards the end of April. So if this is your situation, or you know someone who this is their situation, and it's not just about NETs, it's any sort of cancer. So, you know, in your broader life, if you're aware of someone who that might be relevant for, then I just wanted to let you know about that. The other thing I just wanted to let you just remind everybody is that our branching from our Facebook private discussion group, we have a monthly Zoom meeting. We alternate between a Tuesday evening and a Friday afternoon. So next week on Friday afternoon, it's our Zoom group meeting. So I will make sure that that's posted loud and clear as an event in our private discussion group on Facebook, and everybody is welcome to join in on the conversation there. We don't have guest experts, we don't have an agenda. It's an informal chat. It's a chance to see each other's faces and hear each other's voices, and share share our stories and hear from others about what things have been like for them, and just share some support. So you're really welcome to come along to that. I think it starts at 2:30 in the afternoon if you're in Melbourne time on Friday afternoon. And that's all I've got to plug. It's been lovely Lovely talking with you, Kathy, and great having everybody joining in the comments section today online. And I'll look forward to Facebook Friday next week. Now, we do have a next, yeah, I knew there was something else I needed to plug for next week. A lot of you have heard of Dr. David Chan from Royal North Shore in Sydney. He's a young, enthusiastic, very, very, very smart doctor who is incredibly keen on learning everything he can about neuroendocrine cancers, including participating in research, and he's just recently completed his PhD into neuroendocrine cancers. So he's very much an enthusiast, if there can be such a thing in the doctor's world, but he's recently participated in the European Neuroendocrine Tumour Society conference, which is our big annual international learn everything about, you know, what's going on research wise in NET. So he's just participated in that conference a couple of weeks ago. It's our chance to give him a good grilling. So he's coming along to Facebook Friday. I think he's a little bit nervous about what we might ask him. I've certainly got some questions lined up about the NET test, which is a frequent thing that we keep coming back to, but I'm sure you'll have other questions for him. So I'll post an event for that Facebook Friday broadcast fairly soon, and people can start, you're welcome to start putting in your comments about, well, what do we want David to talk about? We'll only have him for a short period of time, so he won't be able to tell us everything there is to know about NETs, but I'm looking forward to getting some key questions answered with him. So that's where I'm going to leave it. Thank you so much, Kathy.
Thanks, Kate.
And thank you very much, everybody, for joining us, and we'll see you all next week.